to be very conscious of what they're consuming, because nutrition has a powerful, potent impact on overall health. And for those patients who have chronic disease, which is unfortunately the overwhelming majority of us, yes, carbohydrates can be restricting carbohydrates can have a powerful therapeutic effect on diseases like type 2 diabetes. The American Diabetes Association in their 2019 consensus report described type 2 diabetes as the most evidence-based nutritional strategy. We know that it can have potential positive impacts on things like Alzheimer's disease. There are studies that have looked at this. We also know that for
carbohydrate restriction, we're talking
yes,
about.
Yep. So, and I like to term this therapeutic carbohydrate restriction because it's the therapeutic outcome of a carbohydrate reduction. And that's really the goal of this is, can you improve your overall health? Many people will just do this simply to improve, to lose weight, to feel, like you say, to feel more cognitively alert. But in my case, where you're further along the metabolic spectrum with diseases like diabetes, it has a even more potent impact on how you feel, even more potent impact on your overall health. But unfortunately, about 93% of Americans have some form of metabolic derangement, as cited by multiple studies and multiple research groups.
You did a 10-year study on the impact of the ketogenic diet on a patient that had type 1 diabetes. I think this is most certainly the longest study ever done of its type, where you took one individual and over 10 years you, I guess, controlled their diet?
So we had access to the ability to monitor a unique patient who had type 1 diabetes. And they were diagnosed and had followed the American Diabetes Association diet, a healthy diet, for 6 years, and then switched over in 2013 to a ketogenic diet. Upon the initiation of the diet and post, they had DEXA scans. They controlled their calorie intake, their body composition. They weren't taking any additional medications. And we were able to monitor the impact over a 10-year period while controlling all those variables. And why that's so important is because one of the common concerns of a ketogenic diet is the hypothetical risk it can increase cardiovascular disease. And the reason that they think that it can increase cardiovascular disease, or it's hypothesized that it will, is because of the elevation in LDL that often accompanies an increase in saturated fat in the diet. Now, saturated fat comes from things like animal proteins. It's in coconuts as well.